Thank you again for taking the time to join us today. I'm Lauren Laidlaw. I'm on the sales and marketing side here at Safety Partners, and I'm thrilled to be here today with our President and Chief Operating Officer, Jennifer Reilly, and our Director of Quality Research and Training, Caroline Slater. They will be giving you a brief overview on the issues that Safety Partners can certainly help on and take questions on as you're wrestling with getting people back to work in the midst of this pandemic. We really want this session to be about you and answering the questions that are most important to you. So please, at any time, feel free to send us a question by clicking on the Q&A icon at the bottom of your screen. We want to make our presentation as short as possible so that we can make our time with you as productive as possible. So at this point, I'm going to turn it over to Jennifer Reilly, our President and Chief Operating Officer. Thanks.
Thank you, Lauren, and good afternoon, everyone. Thank you so much for getting on this webinar with us today. We're both humbled, we're all humbled and thankful. We're humbled by all our clients and the incredible work that you do, and we're thankful for the opportunity to support you. Our continued mission at Safety Partners, now more than ever, and certainly at the forefront, is to keep employees safe, our facilities compliant, and operations running smoothly. Like all of you, we too are continuing to monitor the COVID-19 pandemic and how it's impacting all of us in our community. We're looking forward to our discussion today, and as we look to return to work in the wake of this COVID-19 and ramp up operations, of course, when the time is right. The situation is evolving daily, and we see and we all hear guidance from the state and federal officials, and this is also changing with new information daily as it becomes available. So our goal today is to do our very best to be able to answer your questions with the guidance that we have today. But know that we are continually monitoring and will revisit as appropriate as guidance changes. So at this point, I'd like to introduce you to Caroline Slater. Many of you, I'm sure, have had the pleasure of working with Caroline. She's a long tenured employee at Safety Partners, having been with us for 13 years and has taken on increasing responsibilities in her time here. So beyond her days directly providing consulting services to our clients, she's now our Director of Quality Research and Training Group, and really has the best vantage point about trends that we're seeing across all our clients, since she's helping to support all our consulting safety officers in the field. So Caroline, thanks for being here today to help with this endeavor. And with that, I'll turn it over to you for your opening remarks.
Thanks, Jennifer, for your introduction. And good afternoon, everyone. Our goal is really to help our client with business continuity and how our client can start to ramp up operations while at the same time providing a workout environment that's as safe as possible. Today, we'll try to answer as many questions as possible during this webinar, while keeping in mind that the public health guidance is continually changing. So when we encourage you after this session to follow up with your consulting safety officer to discuss and brainstorm on things that would be specific for your site. So thank you. Now we're ready for some questions.
Thanks, Caroline. So we have a few questions coming in from the group. One of the first questions is, should employees be wearing masks while working at their desks? As I am.
So the CDC guidance is that people should be wearing some form of face covering when they cannot maintain social distancing of at least 6 feet. And in an office setting, it's a good idea to wear some sort of covering. Yes.
So another question that's come in is if you could speak a little bit to what are the advantages and disadvantages of wearing gloves in non-laboratory areas?
So there's definitely pros and cons of wearing gloves in the office. I think it might give people a false sense of security. Their hands are clean, but their gloves will become contaminated, and so they may be still touching their face and nose while they're wearing gloves. And if they are not used to wearing gloves, like lab employees, the office employees may be removing their glove the wrong way and contaminating their hands at the same time, and not thinking that they should still wash their hands. So there are some tasks that definitely it would be good to wear gloves, like wiping surfaces, then you probably should wear gloves. Maybe it's a good idea also when receiving packages. If you are going to take people's temperature, it's a good idea to wear gloves, but there's definitely probably more cons than pros just wearing them in an office setting. And if you are going to do that in an office setting, then you want to really separate the glove that are used in the lab from outside the lab. So I think we do have a client that has a changing station at the lab, just outside, just leaving the lab, and they're using different color gloves to differentiate between the lab gloves and the office gloves.
Yeah, it's interesting that we're all learning new behaviors and behaviors that are different from what we've been what's been ingrained in us to not do, like gloves in the cafeteria and such. So thanks for that guidance. Several people calling in today are asking about what the permit landscape is looking like at this time. Are permits and inspections happening in the city of Cambridge and other municipalities, and what in general are we seeing?
So a lot of the governmental agency have given some guidance in that regard. Like, for example, the Mass DEP has guidance as to more relaxed regulation in terms of meeting requirements for different things like hazardous waste generator status, for instance. But for the different towns, we have to work with each, like Board of Health, for example, as to how can we get the permits still being issued. And so we have to be creative. I know that Board of Health are very, very busy these days. So some have agreed to maybe do some remote inspection using some remote tools like FaceTime or Skype, so that they can still come in and in a way to see the space, or some have delayed inspection and given conditional approval. I know that in Cambridge, Sam Lifson is trying to work with each individual company so that there's no delay in getting their permits issued.
So would you say you're seeing that same is true for amendments if someone has existing labs and they want to change their designation as some research has changed, say from BL1 to BL2?
So typically in Cambridge that we required going to the CBC to present again. So I think they are like very busy right now, and I'm assuming they'll have some guidance soon on bypassing the presentation and presenting later. Maybe eventually they'll do some remote presentation. I know that in Waltham, for example, we can forward the slides, and so people don't have to go to present right away, but they can forward the slides, and later on inspection will be happening. So I think each cities and town are trying to find out the best way to keep operating, but things are slow and definitely operating in a different manner.
Yeah, it's great to hear that they're trying to work as flexibly as they can and still, maintain laboratory safety and laboratory safety practices, but also make sure that companies can continue to do the critical work that they do. So can you elaborate a little bit on the pros and cons regarding asking employees to take their temperatures before showing up to work versus the employer taking the temperature when the employee shows up to work?
You mean employees taking it themselves as opposed to employers taking the temperature for them? Well, if people are taking the temperature, I'm assuming they're taking it like when they get to work, and if they're all using the same thermometer, that's, many people are handling the same thermometer, as opposed to having the employer do that with a dedicated person each morning wearing face mask, safety glasses, gloves, and in some case they can wear a gown also. At least you have one person taking the temperature. So you have to have someone available to do that. And you need the thermometer, and they're very difficult to get right now. People are able to get them right now. They're getting some model that only read in Celsius, not in Fahrenheit, and it may take weeks to get delivered.
All right. And so one of the big questions as it relates to personal medical information in regards to monitoring temperature is that, concerns over privacy policies for this health information. Can you speak to a little bit of that, of what you're seeing?
So the temperature, and also the question, sometimes employers will ask question or have a questionnaire about, are you having a fever today? Are you feeling sick? Have you have you had contact with someone who was sick? Have you traveled in the past 14 days? But the medical question themselves and the temperature is considered HIPAA, protected information. So if people are using a questionnaire, those questionnaires have to be protected. So somewhere in the locked cabinet. And also, you should have a private area for people to answer questions. I know it's difficult. Some clients have installed like a shower curtain to, separate people a little bit so that, some employers have hired nurse or a nursing student to do these checks. And they try to provide them with a little bit of private area to answer question and take the temperature.
Oh, that's great. We've had a lot of questions about temperature taking and privacy and how to protect it, whether it's okay to do it. And certainly we don't want to provide legal information, but and legal guidance, but given that temperature is a strong indicator of being infected, it's something that CDC guidance and public health guidance often trumps, in this situation, trumps keeping or the ability to not ask that. So that's also, what has come up. So one of the tricky things I think that everybody is encountering, you mentioned about taking temperatures, but also where to get these supplies and thermometers. But have you heard of any clients, finding luck and getting, face covering supplies to purchase for employees?
So the face covering, like maybe like a surgical mask, people have ordered them, but they're not going to be delivered until June. So it's very hard to find. So a lot of places are doing the face covering, like the one you're wearing. So that's working well to at least protect others, protecting each other against droplets, respiratory droplets. And so that should be a minimum. But it's very difficult to get like a surgical mask right now. And for N95, even more difficult, and really those should be reserved for either healthcare worker or if your operations are requiring N95. For example, if you have an animal facility where you have a mandatory program of wearing an N95 to protect against allergen, then you can, OSHA has given the okay to go to other sources from other countries, and they have published a enforcement memo with a list of non-NIOSH approved respirator, including other types of N95 that are not called N95 from other countries that are equivalent. So they are now allowing people to get those for workplace hazard. And they also have relaxed their requirement for fit testing. Originally, they relaxed only for the healthcare worker for the requirement for the annual fit testing. But last week, they issued another memo relaxing that fit testing annual requirement for all workplaces.
Oh, that's great. It definitely provides more flexibility in the supply chain and, helping people, companies to best protect their employees.
And would you mind just reminding folks how to ask a question, or I can?
Well, yep. So welcome to those who have joined. We have quite a few attendees on the line, so we're thrilled to have you all here to be able to utilize Caroline's time and expertise in answering questions. So if you see at the bottom of your screen, there's a Q&A icon. You can just type your question into that prompt, and we're going through the questions and asking them. So one of the questions that's also come up in relation to the regulatory landscape is related to Watertown moving forward with their recombinant DNA ordinance. So maybe you could give a quick update on that, since we just provided some additional information last week.
So last week they pushed back the regulation was supposed to take effect May 1st, and now it's going to be July 1st. So there's a lot more time to get into compliance, and existing company will have 1 year from that date to get into compliance. So they'll have until the summer of 2021. So that gives people time, but it's a good idea to get started, because companies will need an IBC with one community reps, a Watertown resident. So it's never too early to start writing your project registration and forming your committee.
So there's been a few questions from the attendees related to sharing space. So whether it's sharing space in a incubator setting or shared spaces, and also how that also applies to conference rooms. So could you speak to a little bit about like what are the best practices that our clients should be thinking about?
So I'll start with the conference room. We're supposed to keep at least 6 feet apart. So I would say in conference room, don't fill them more than, I know it's difficult. Sometimes the conference room are very small. So not having people more than 6 feet apart if possible. And if you think it might be difficult to maintain, it might help to remove chairs. Same for the kitchen area. And so the shared space, you'll have to look at your individual situation. Let's say you have small tissue culture room or microscope room, maybe people have to sign up to use that room. Maybe there's more like a staggered shift. Some people working more an early schedule, a later schedule. If you have a lab that's a very big lab and you have 2 entrances to the lab, maybe you're making one an entrance and one an exit, except in case of emergency. So you have less likely that people will cross each other coming in and out of the lab. Some people have put tape on the floor to indicate the direction of movement in some areas of their space. Like in kitchens, some people have also put tape on the floor to, prevent people from being too close, going to the microwave or the fridge. Increase wipe down of surfaces several times during the day for high touch point items. Making sure that people don't share things like headsets. There's a lot of things that people can do in shared space. I know it's not easy. That's like rethinking the whole way that we work. Trying to work remotely. If someone doesn't need to be in the office, they can work remotely as much as possible. But also you have to think about if people are going to work late, your lone worker policy. You require the buddy system if someone is coming on the weekend, in the evening, and are there some tasks that are too hazardous to conduct when no one is around?
Oh, that's great. It's a great segue into also thinking about as companies are looking to ramp up and they're doing different shifts. More employees might be working in hours that are considered off hours or off hours when occupational health centers are closed. So could you talk a little bit about the guidance, for non-emergency work-related incidents? There's other medical providers, but what if, if there's an ER, need to go to the ER? And so what guidance would you give to clients?
So in the past, when the occupational health clinic is closed, usually after 4:30, we've told people you should go to the ER, but now it's not a good idea to go to the ER. So, but several of the urgent care clinics are still open, and some of them have remote session like telehealth. So I would recommend that companies check with their closest urgent care clinic and contact them, see what their opening hours and policy is for visiting. Some do require a phone call in advance to, so that they'll ask you a question to make sure you don't have any symptoms of COVID-19. So those clinics are a good resource. Most of them are open until 8 or 9 in the evening and on weekends too.
Oh, excellent. It's good to have additional options and hopefully minimize incidents and accidents. And we all know that when it's times like these that we're working in different ways, that we want to be most cognizant of changing procedures and how incidents often happen, when there are changes. So what guidance would you give for visitors and deliveries to facilities? Of course, it's an integral part of having, facilities technicians come in or service providers come in on site, whether it's servicing a piece of equipment or making deliveries, for these businesses and our clients to continue to thrive. So what are you seeing for guidance on visitors and deliveries?
So for deliveries, a lot of companies have implemented gloves and of course masks at the loading dock during the delivery. Many companies are like unpacking everything, getting rid of the cardboard box, even though the virus is known to live only 24 hours on cardboard box, but those were probably touched recently. So some people are removing the box at the loading dock, dumping the box in the dumpster and then bringing the material up. There's also concern about signature pad, whether or not, you're going to touch something. Do you need your own pen? So there's a lot of things around that for deliveries. For visitors, people are trying to limit to only essential visitors. But like you said, you also have you may need calibration on equipment in the lab, and you have vendors are coming to repair things. So you may also discuss with your vendor, like, to make sure they don't, they have their own policy for not sending people over that may have symptoms. And some companies will also take the temperature of those visitors the same way they do with their own employee.
So a couple clients have asked, if we have policies and procedures, and maybe you could talk a little bit about the COVID-19 policy that you're working with our consultants to put in place, and also just where that back to work information comes from and the resources that we're using.
So we've come up with a long list of things that clients can do. No client will be doing all of the things that are on the list, and it's all subject to discussion with your particular situation with your safety consultant, so that you have a policy so that you can still operate. And there are a lot of different things you can do at your facility, having different tiered of workers, some that are essential, need to be on site every day, maybe your facility's operation, some that can be, don't need to be on site at all. Maybe the finance person doesn't need to be on site for most of the time, and some that are in between, where some days they may be able to work from home and some days they may not. And it can address also PPE requirement, any change in PPE, lone worker policy, as I discussed, high traffic area, encouraging, like, good hygiene etiquette, providing, hand sanitizer, touch-free options for, like, the garbage, for instance, increased wipe down of surface, high common surface, even for evacuation procedure, right? So hopefully you won't get an evacuation during, when you're working, but what about at your rally point? Can you maintain your 6 feet distancing at your rally point in place of an evacuation? Procedures in the lab also. Again, there's a lot of high touch point area in the lab, incubator, fridge and freezer, making sure you don't bring personal items in the lab. Policy for cell phone use in the lab, that's always something we think about, but it might be more important now. Maybe having people cross-train in different tasks. There's also discussion around animal facilities, since the animal have to be taken care of, and what if someone gets sick, how you're gonna make sure that you have enough coverage. And something around regulatory compliance we can help with, as far as what's required, what's not required right now. There's a relaxing of the regulation, and when should you write a note to file to document why you cannot comply with some of the regulation. Any travel restriction from your employees. We talk about visitors and contractor. And also it's important, training and communication, how you communicate all of this to your employee, being transparent, making sure they are informed, and do we need to do extra training on these new policies?
Right. Yeah, training is a big communication piece, and that training is so important. So, many clients that have tissue culture space and biological safety cabinets, they're used to turning on the UV light at the end of the day. Maybe not so much anymore. It's not quite recommended across the board, but are you seeing any clients, and would you recommend the use of any type of handheld UV lamps for disinfecting areas such as, non-lab areas like cafeteria, mailroom?
So the UV light that will be effective against this virus is UVC, which is the same wavelength in your biosafety cabinet. However, the virus is very sensitive to soap. It's an envelope virus. It's sensitive to alcohol and a lot of other disinfectant. So on the EPA website, you'll see the list of disinfectant effective against this virus, which is the SARS-CoV-2 virus. So you don't need to do anything special other than good cleaning procedure. The virus doesn't live very long on surfaces. I have a list. It's like on cardboard, about 24 hours. On copper, not very long, about 4 hours. Aluminum, 2 to 8 hours. On other metal surfaces like stainless steel, it can be up to 5 days. On glass, it could be up to 5 days as well. So some people have switched from like, not using silverware and glass and, ceramic in the kitchen and go back to disposable paper. The length of time may vary depending on the type of paper, plastic 2 to 3 days. So just good cleaning practices will be enough. You don't need to go with the UV light.
So also in line with that, would you recommend any air purifiers or filters to increase clean airflow in office spaces?
So there was a recommendation in the healthcare industry to increase the air and maybe HEPA filter. But the guidance now from the CDC from last week is that if, for instance, someone was to test positive, if they haven't been on site for more than 7 days, you don't need to do anything special. If the person was on site within the last 24 hours, they recommend that the immediate area, let's say that person was in one conference room, they recommend for that conference room not to be occupied for 24 hours. And then you can just do the cleaning of non-porous surfaces, like with detergent or and a disinfectant, and that's enough. You don't need to do, like some people have been fogging with chlorine dioxide or vaporized hydrogen peroxide, which it gives people peace of mind, but it's not needed. If you do, and you can certainly, I think people are happy to have the peace of mind for their employees, but if you were to do fogging with like VHP, vaporized hydrogen peroxide, if the next day the first person who comes in is positive and asymptomatic, if the person start talking, your space is already contaminated because the person could be shedding the virus. So it's clean. The space is clean until the next person comes in.
Right. So you mentioned earlier in some shared cafeteria spaces going back to disposable. But in the event that companies don't want to do that, do you feel using a normal cycle of a dishwasher with the detergents and the stringency of that is enough to kill the virus?
Yeah, that is enough. And then it's a decision who's going to take them out of the dishwasher with clean gloves and make sure the person is not touching their face, you know.
Yeah, it's lots of details to think about. So how about guidance for commuting to work? This is really, we all want to be green and do things that are environmentally conscious, but there's been a lot of talk about not using public transportation. And so what guidance do you feel comfortable with as far as commuting to work?
That's a difficult one. A lot of companies are discouraging the use of the public transportation, and sometimes they offer the option of paying for someone's T-Pass or paying for the garage. So they've given the option for people to go the other way and use the garage instead. So it's really an individual decision. That's hard. Some people do not have cars or don't have good ways to get to work, with a car. So that makes it really tricky. But of course, when you're in a public space, like a bus or the subway, you're more in contact with people, so that increased the chance of exposure, definitely.
So in our laboratories, we're seeing people are using lab coats and they send them off to be laundered as usual. You wear them a few times. Are you recommending that people change PPE more often? Change their lab coats more often, put it into the laundry with increased frequency?
Definitely. I mean, we all seen lab coats on hooks, and the back of the neck is not looking very good. So that's
more than a couple of days.
Yeah, more than a couple of days. So I would say, try to have people change them often, or someone can go by and put them all in the laundry, assuming you have at least 2 or 3 coats per person. So if you have a weekly service, and I'm assuming, I don't know, but I'm assuming the service hasn't changed, hasn't slowed down as far as returning of the coats. Some people are moving to disposable, but it's hard again. Supplies are hard to come by.
Right. So I'm just looking at more of the questions that have come through here. And one of the questions that's come through, and we've heard some in the news about machines that have been brought in, but as far as decontaminating N95 masks, do you feel like, our laboratory clients can do that themselves in their lab space?
So some companies are offering the service. I know that Air System Technology is offering the service. I think it's with Ozone, not VHP. But right now, the offering seems to be only for the healthcare industry who needs it most. So I think it would be difficult for clients to get that service, but they can always try. I think they may not have the, well, there are not a lot of places that can do that. And also the companies may not have the volume of PPE, enough to make it work for the vendor to come by and do that for them. Because you're getting the same PPE back, you're not getting somebody else PPE.
So some of our clients, have medical sales professionals, they're meeting with doctors or hospitals, and what kind of additional guidance should we give them?
So the same, wearing a face covering, try to keep social distancing. Also, if they are going to visit, there might be other policies already in place, very strict policy actually, if you're gonna go visit a doctor's office or in a hospital. Some may even be delayed, those meetings or visit, or they may be done remotely now if there's not a good reason to be there on site.
So as clients look to start, ramping up and having employees come back on site in the lab, we're seeing, in general, a little bit of a mix, some that are still closed and some that are having employees. Are you recommending that they do staggered shifts, or?
That would be a good idea if you cannot maintain enough space, the 6 feet distancing between people. But again, you have to look at your operation if it makes sense, if the work is very hazardous. You don't want people to be alone, working alone. So it's a decision that each company should make for themselves. Sometimes if it cannot be done in the evening, then maybe people will have to operate at a reduced rate, a reduced, workload.
So one of the, a good question that just came in here is, talks about, donning and doffing PPE, and explaining the most effective way to do this when they have masks and gloves, and what's the best removal steps. What goes first?
That's a good question. So you don't want to touch your face with potentially dirty gloves, right? So there's proper removal technique for the glove, and for the mask, you're supposed to take the air loop. Actually, in between, you should be, and there's a lot of good videos that we can provide you from some training for that. But you should be using hand sanitizer or cleaning your hands. It's not always possible if you're in the lab, depending the situation. But you should have clean hands to remove the air loop and not touch the front or the back of your mask, and then you can take off your lab coat. That's a good one.
That's a good one.
It's a lot to think about. We're always supposed to do it the right way, but now people are more aware of it.
So a few more questions related to, using common areas. I think that's, people feel like they maybe can distance well in the lab or distance when they're in the offices, but how about, shared cafeteria spaces, eating in cafeteria spaces? Do you close those down temporarily?
So that's a good question. People will still have to go and get like water and maybe warm up their food in the microwave. So people may still have to go in there, but not all at the same time. And we do have some clients who offer catered lunch every day, and they move, instead of having open containers and people in line getting the food, they move to single serve, so people grab something and go back to their desk to eat. So it really depends on your setup, the situation. I mean, people typically need access to the fridge, the microwave, but maybe, you tape on the floor, you put some, like we see at the grocery store, the pharmacy, taping, on the floor at 6 feet, and people wait in line to go in the kitchen.
So can you provide some clarity when, we're talking about this 6-foot rule? So now we have maybe it's very clear in some common non-laboratory spaces, but now you have, researchers in the lab with full PPE, face masks included. Does that 6-foot rule still apply?
That's a really good question. I think if someone was wearing a PPE like a nurse, with the actual N95, I mean, they get close to their patients, so I think you could decrease. But if someone is wearing a face covering, like the one you're wearing, Jennifer, so that's not an N95. So there, is some air, it's not sealed. I think you need to provide more distancing in that case if you don't have N95. But also it's different setting to be in the lab with a coworker as opposed to a nurse in the hospital who's going to be close to actual patient who are, positive and probably shedding the virus. So, and the guidance keep changing. So every day I look at the CDC website, the World Health Organization, anything from the local public health, because it keeps changing. We don't know everything about the virus yet. So.
So that I'm not seeing any additional questions. If there's some folks that joined a little bit later, you can go on and you can go to the icon at the bottom that says Q&A and ask some additional questions. So someone just chimed in and said they missed the response, and maybe you could just reiterate a little bit about how long you'd suggest performing shift work and distancing. Would you base it on state and federal suggestions?
Yeah, we need to follow the public health guidance. We don't know. Everybody's talking about reopening. People have different ideas about how they want to do that. So, we need to see what they have to say. And as they learn more about whether or not, people are immune, there were some report of people getting it the second time in Korea, and we don't know why. We don't know if that fully recovered. Now they are talking about antibody testing. Some people may have had it and not known, but antibody testing, what does it mean? Does it mean you have antibody, you're actually immune? So we don't know what that level is. So there's still a lot of unknown. But companies are slowly beginning to, some companies have remained open, some biotech companies, just working a little differently. So, and some, slowly people are ramping up, and so we'll have to watch for that guidance.
So are you, any additional thoughts on that, on contact tracing?
That's a good question. So MIT, I saw that the other day, MIT is looking into an app. I forgot the name. I don't have it in front of me. But MIT is looking into an app and, using Bluetooth. Governor Baker also wants to hire, a team to do, to work with the public health department. Massachusetts is unique. Each town, this city and town have their own public health department, and they're given a lot of leeway. So Governor Baker wants to work with them to have people in charge of contact tracing. So stay tuned, there'll be more. There's also concern with the MIT, and also Facebook has also talked about using a Bluetooth app, but there's also concern about privacy. But what some companies are doing right now to help public health department in case they get somebody who's positive is they have instituted a policy that people should use their own key card when going to different place in the building. They should not be piggybacking when, behind somebody, so that if someone is positive, they can kind of see where the person has been in the building by looking at the key card record. So that's one option for the employers right now.
I guess that's true all the time. We want people to swipe in, swipe out, just knowing who's in the building as well. But even more important when you're trying to find out where someone, has been within the facility. So a couple of clients have chimed in to ask if you recommend the use of face shields.
That's a good question. If you can get them, the very light one, with the foam, and if you get them, that would be great in some circumstances. Like, speaking of face shield like this, there are also some companies who are putting like some kind of shielding between workstation, either in the lab or also in an office setting, either like a plexiglass or acrylic, or even those thin plastic shielding if you cannot maintain a separation when you're sitting next to someone, so you can have those shielding to help. Really what you're trying is to minimize the projection of droplets, respiratory droplets, when someone is talking, someone is laughing. It doesn't hurt if you have them. They might be difficult to get, but if you have some, and they're easy to clean as opposed to a mask, so you can wipe them and reuse them, definitely.
So Caroline, did you have, we've had a lot of great questions from our clients, and are there any particular sage advice points that no one's asked about that you'd like to share with the group?
Let's see. Well, so I think a lot of people are familiar with recordable injuries and incident. So one thing that there was a memo issued by the Department of Labor saying that if someone contract COVID-19 in the workplace, that could be considered a work-related illness if it was contracted in the workplace. If it was, if the person required, medical attention beyond first aid, so that they did issue a memo, but they also say that unless you're working as in a healthcare facility or as an EMT, OSHA is giving you more time to figure out if it was really work-related or not. So that would, if it was work-related, it would go on your OSHA log. But they're giving you a lot of time to figure out, because it might not be easy to figure out. Usually within 7 days, you have to fill that OSHA 301 form, but they're giving you more time to figure out if it's work-related or not.
I know we're getting close to the time of the call. I just wanted to, one more question, and then I'll turn it back over to Lauren. So have you seen any official guidance from Massachusetts or Cambridge more locally about specific recommendations for returning to work in shifts, or has that just been a best practice?
That's been the best practice, as companies are trained not to shut down their operation completely. So I haven't seen any guidance at the local, state, or federal level.
Great. Well, thank you so much, Caroline. You've really done a great job of helping to highlight some of the questions that I'm sure everyone in the group had similar questions. Thank you all for calling in. It's been great to be able to chat with you a little bit and over questions. And with that, I'll turn it over to Lauren.
Well, everybody, thank you so much for being part of our first webinar focused on Q&A about returning to work in the wake of COVID-19. If you have questions that you didn't ask, if for any reason, please feel free to reach out to your Safety Partners Consulting Safety Officer to answer questions, to get more information on how we can help you with your policy. And as always, you can reach out to me at any time. This webinar has been recorded, and I will make the recording available to everybody. So once again, have a wonderful afternoon. Thank you for taking the time with us today, and I hope this is the first of many interactions like this. Thanks.